Hi, my name is Jordan. Basically, we've devised a video to help with the condition of osteoarthritis. So I'm just going to describe what osteoarthritis is for those who don't know. So basically, it's a degenerative disease that affects your joints. It can sometimes be called osteoarthrosis or arthrosis. Basically, it affects the cartilage in your joints due to wear and tear, so it mostly affects people of an older age. And it can affect the bone thickness, so it's normal to experience pain, stiffness and swelling. And severe arthritis, you can experience changing joint shape, which is forcing the bones out of position, which isn't good. So basically, this video that we devised is to help you reduce pain, increase your range of motion, fight muscle atrophy, which is your muscles wasting away due to lack of activity, and basically improve your range of motion so you can pause it. It will also help maintain your activity and be good for activities of daily living, so such as going to do your shopping, walking the dog, etc, etc. So these videos will just show you exercises to do in the gym or at home or a clinical setting. Okay, so this section of the video we're just going to talk about a few lifestyle changes that can ultimately help you with your osteoarthritis. So firstly, it's very important to maintain physical activity, because avoiding you can lose muscle mass. So physical activity can help develop and maintain your muscles, and that can ultimately relieve stress in your joints. So the exercises that you're going to witness in this video are designed to help with this. So you got some strength exercises, range of motion exercises for reducing stiffness and improving mobility, and also some endurance exercises, so that's healthy for the heart and also losing weight. So any questions more on the exercises, seek help from your local physio and also your doctor. Just going to talk about a little bit of weight loss as well. So weight loss is important, obviously, to reduce stress on your joints. So this can be achieved from, again, physical activity and also changing your diet. Also eating foods that help with anti-inflammatory, because osteoarthritis, you get a lot of inflammation in your joints, so that can help as well. It's also good to avoid foods and drinks that got caffeine, alcohol and smoking. Again, more advice you can seek from your physio or doctor. And also the last point I want to make is also good to maintain good mental health throughout this process. So if you want any more information on this, it's available on the NHS website.
So for this exercise, you're going to be lying on the bed, which you can do at home, or you can have a lie down on the floor. Make sure you use a pillow to make sure your head is supported, and then you're just going to put a rolled up towel or a pillow just underneath the knees. And all I'm going to ask Jay to do is just use these quadricep muscles. So you're going to squeeze these muscles and think about squashing the back of your knee into the towel. You're going to squeeze and hold for about 5 seconds, and then I just want you to relax, and then we're going to repeat. So when we're doing this at home, you just need to try and work out how many repetitions that you can comfortably do. You want to feel like you're working hard but not over fatiguing yourself. So have a go at trying approximately 8, but you might find you can do a few more or a few less. And then when you've worked on one leg, you're going to repeat the process on the other leg.
So for this exercise, all we're going to be doing is just bringing the heel to the bottom. Obviously this is a smooth surface, so at home you might have to use a pillowcase or a towel or even a plastic bag. So all I'm going to ask you to do is bring the heel to the bottom as far as you can. Obviously you might not be able to do this, so just go as far as you can and then back down and keep working on it. We're going to do up to 10 of them on each leg. Nice and slowly, don't go too fast. And that's it.
So this exercise is leg abduction. So I'm going to do my patient Rachel. She's going to abduct her leg, her left leg going out towards the side as far as she can go, and back to the middle. We're going to do that for about 10 repetitions each side. So as a patient, you need to do this in bed every morning. Just bear in mind that this surface is smooth, so we're going to need maybe like a bag or using a bed sheet, something what is going to be slipping, make the feet glide across the bed. So we're going to do a couple more. That's perfect. Like I said, you're going to take it out to your range of movement, so as long as it feels comfortable when you do the movement.
So the next exercise, how we're going to be doing, similar to what we did before. So we're going to be just pushing the knee down to the bed, and then after following that, we're going to lift the whole leg up nice and straight, as far as you can go, obviously, and then back down. See how it's nice and controlled. You don't want to rush it too much, and then keep going. We've got 10 of those. Perfect. Press down, contract, back up.
So just carry on. So when you're sitting in your chair throughout the day, approximately once an hour, just make sure you're having a stand up, have a little walk around the room, or you can have a practice at doing some sit to stands. So nice, easy, functional tasks to help you with everyday tasks. You're going to put your hands on the side of the chair, and then you're going to use your upper body and push through into a stand position. And then you're going to slowly lower yourself back down. So hands on the chair first, and then lower yourself back down. And then push up again, and then lower back down. So again, have a go, see how many you can do. Maybe start off with 5, have a little breather in between, and then go back to it, or if you can do more, then go for more.
So this exercise is just a basic sit to stand. So the patient just stands up and then sits using the support of a chair or any piece of equipment to sit on. Just looking for full extension of the knees when standing up and good range of flexion in the knees when sitting.
So when you sat in your chair in the daytime, similar to when you're lying on your back, you're going to squeeze your quadricep muscles, which are these muscles on the front of the leg. So if you can do that for me. And then we're going to extend the leg out in front, and then you're going to control the leg back down. So if you have a look at how Jay's moving, it's a nice controlled movement. And again, you're going to have a go at doing approximately 10 repetitions, but you might find you can do more, or you might find that you're doing a little bit less. And then make sure you have a go on the other leg as well. If you're happy with that exercise, you can progress it on. So this is an ankle weight which you can buy on the internet for quite cheap. And all you're going to do is add it to the bottom of the ankle. Pause the video. Okay, so we're going to do a single leg extension, but we've just added an ankle weight to the leg. And you can buy these easily online if you want to use them. So I'm just going to get Jay to squeeze his quadricep muscles on the front of the leg and use this to help him lift the leg up. You'll find it hard with the weight, and then bring the leg back down, but it'll just help you to strengthen the leg muscles a little bit more than if you were going to use it without. Okay, so we're going to lift the leg up for this exercise, and this is going to be our start position. From here, you're going to bend the ankle as much as you can, and then point the toe away. So we're going to try and get that full range of movement. Try and move from the ankle as well as the toes, so if we keep moving through that range. And a nice big pull up, and when you pull up, try and hold for about 3 to 5 seconds before you let it go, and then lower it back down. And that's going to help to strengthen some of the muscles in our lower leg, so that we can strengthen the whole lower limb. So for this exercise, we're going to be using a TheraBand. You can order these online for quite cheap. You can either get them as a rubber tubing or on a roll. And all we're going to do, I'm going to ask Jay to pull his heel towards the chair, and we're going to be using our hamstring muscles, which are the muscles on the back of the leg in the upper thigh. So all that's happening with this resistance band, it just helps to give some extra work so that you can feel like you're working hard, but you can do it without if you don't have this equipment or if you find it a little bit too difficult. When you're at home, you can either ask somebody to hold it, or if there's not anybody available, you can look to tie it onto something nice and stable and then bring the leg in. Go. So for this exercise you need a Swiss ball. You can do it at home or you can do it at the gym. You're just going to lean against the ball, so you'll be standing on a very slight diagonal if you have a look at Jordan on the way up, and then we're just bending through hips and knees and ankles, coming down roughly to about 90 degrees and then coming back up. Make sure that you use the ball to help support you on the way down.
So this is a regression from sit to stand, so using the suspension trainers to help push off from the seated position. So as you can see, the patient's feet are flat on the floor, brings himself up, back straight, squeeze at the top. So this is a perfect technique to show this adapted sit to stand using suspension trainers, which you can buy online and in stores quite cheap.
So just using the suspension straps to facilitate squatting movement. So they're just tied to the wall and the patient has firm grip on both straps. On the squatting movement, so knees don't go over the toes, back straight, and just getting full range of movement in the knees and hips. These straps can be bought from the local store, so you can use them at home.
So for this exercise, what we're going to do, we're going to hold on to the bottom banister, and then we're going to go into one leg, take this left leg through, and then back down, and then we need to turn it in. What you're looking for there is nice controlled movement. You don't want to rush, you don't want to go too slow. And then just every 10 of them, and we're out to the side, lift your count. Get hold onto the banister to make sure that it's nice and safe. 10 of them again. And so I've done 10 of them. I'm going to go backwards now. We'll take our leg back. 10 of them as well. So I'm going to do two or three of them in a set. And then what we're going to do is turn around to the other banister. I'll turn around if you've only got one banister at home. And then we're going to do the opposite leg, exactly the same.
So this exercise is a bit more advanced, focusing on a bit different than normal extension and flexion of the knee. So for this exercise, the patient's just going to hold onto a banister at home or a workbench or anything they've got at home. Going to stand on their right leg, lifting their left. And all they're going to do is focusing on the knee, is try and swivel from right to left, focusing on that rotation of the knee. So as again, this is a bit more advanced, focusing on a bit more different movement in the knee. So do it within your pain limits and don't go too far in the movements. So this exercise is just going to be focused on stepping on the steps. So the patient's just going to use this first step to begin with, using the rails as support, and simply stepping with the right then the left, continuously back and down. The patient can also swap legs, so they can go with the left first and then the right. To progress, the patient can also step up towards the second step and then back down. So this exercise focuses on more endurance, working the heart, and also to lose weight. In terms of number of repetitions, you can go around probably 20 to 30 seconds, around 3 to 4 sets. So we're just going to focus on some calf exercises. So what you're going to do is the patient's going to be on the lowest step they have in the house, using the rails to support. And as they lower themselves down, as the muscle extends, and then as they contract, they're using the body weight against resistance. So this exercise, we're just going to focus on a single leg squat using this step. So the patient's on the lowest step they've got, using the rails with both hands to support them. So the patient just simply lowers their leg down, bending the leg that's on the step. So this focuses on maintaining stability in the knee, and also to maintain that strength to hold that position. And then equally, the patient can swap legs by going onto the other rail. So in terms of number of repetitions, you can go to around 8 to 10 repetitions for about 3 to 4 sets. So this exercise is focused on more proprioceptive feedback. So you can use something such as a medicine ball or any sort of circular ball you can use. So basically, it's better to have no footwear on the leg you're training. So simply sitting down, just put your foot on the ball, and then looking forward, just do some back and forth motions, side to side, sort of more circular. And to progress this, you then get rid of the visual feedback, so close your eyes, just focusing, extending the flexion of the knee, and side motion.
So this is training for proprioception, so we've got different colour circles on the floor, but at home you can use maybe pieces of paper with a number written on them, so all you want to do, you're going to go to different colours, using different parts, different feet of different colours, in your own time, making sure you're touching every part. And like I said, you can use different things out your house, you can use pieces of paper, you can use different items, as long as they're different and you know that which foot is going to which, and just randomise them, or even have a partner at home saying foot 2, blue circle, foot 2, paper number 1. So as long as you've got someone there to help you, to give you guidance as well. Right, so today we're going to do some proprioception training with the OE. So one proprioception training in the gym is going to be if we get our patient to walk on slowly onto the Bosu ball. Right, so when a patient's on the Bosu ball, what we're going to do, so this is already testing the balance and proprioception, so as a phase, what I'm going to do, I'm just going to go around the Bosu ball and just move it in different directions, making sure that my patient's aware and that they're activating muscles and also training their proprioception. So obviously putting down and using different pressures on different points in the Bosu ball will create more proprioception for the patient to be working on. So we want our patient to partially squat, move side to side using the resistance bands. Resistance band is around the knees
to help with activation of the glutes. And you can get these resistance bands on many websites and in shops, which are very cheap, and you'll be able to do this at home as well.